Hello everybody. Greetings from Dr. Godbole's Heart Care Hospital. I am Dr. Rajiv Godbole. I am a practicing cardiothoracic surgeon. That means I do bypass and valve surgeries. I'd like to say a few words in simple terms today, as I understand it. Heart disease has become very common, and I'm sure you know why people get heart attacks. Now, what happens after that is a big question. Many people are faced with need for further treatment, which is in the form of an angioplasty, or if it's an extensive problem, then they come to surgery, that is to me. Now the surgery that I do for that is a bypass operation. Bypass operation, in simple terms, is creating a new road for oxygen and blood to reach the heart beyond the block. So if you look at it, it's a simple operation. It's just that there are a lot of misconceptions around this operation, which hold patients from having it. They are scared about the surgery for one, and secondly, they wonder how they are going to do afterwards and what their recovery is going to be. There's a popular misconception that bypass surgery reduces the lifespan of a patient. Now, let me hasten to add that this is not the case. In fact, the two main reasons for doing this is to prolong life and to take away your symptoms so that your quality of life is unchanged and you can go back to a healthy lifestyle for a prolonged period of time. Now, a word of caution to people below 25-30 years of age. We are seeing a lot of youngsters coming with this problem recently, and we would like not to see them at this early stage in life. Coming to heart surgery or the bypass surgery, it's more frightening than it actually is. A typical patient whose bypass we do is sits up and starts gets out of bed on the second day after the operation, walks around for a bit, and the third day, once all the IVs and drain tubes etc. are removed, gets shifted to the ward where he would start leading a day-to-day life as he would at home, but under our supervision. Once the recovery is sufficiently progressed, we make sure that his wounds are healed and send them home, where they start some recuperation and recovery. And within a month, they are back to 80% of what they were doing before. It's just that we ask them not to lift heavy weights for at least 3 months. After that, you'll be surprised to know that so many patients even forget that they have had an operation. Now, for those of faint heart who would not like to have a big cut down the front, down the middle, we normally would do it there. There is a new technique which we use called minimally invasive. That means keyhole surgery. Now, what we do is we make a small cut on the side of the chest, and through that, using sophisticated gadgets, do the same operation. That means that the scars are not seen that easily, especially in women. That's a very popular operation, and patient is back on his feet and doing what he wants to much earlier with less pain. So, to summarize, I think bypass surgery is a safe option. Obviously, we do select our patients properly to make sure that they will get maximum benefit from this. And once you are back on your feet, you will probably be able to not do what you were doing before, such as smoking, drinking, eating high cal food, and not exercising. And that's all I have to say on the matter. So, here's to healthy living and wish you all a long and healthy life. Thanks.